Good afternoon, and welcome to Beyond the Pill, Leveraging IT to Manage Chronic Diseases, a webinar tweet chat combo from healthsystemcio.com. Just some housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of healthsystemcio.com, and I will be your moderator today. We are holding a simultaneous tweet chat hosted by our managing editor and director of social media, Kate Gamble. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can view it in your media viewer panel on the right-hand side of your screen. We're also going to be using the Q&A panel today. That's for you to send in your questions to me. Send them in at any time and leave the default set to all panelists. We'll be taking them later in the program. And you could download the deck by using the URL on your screen. It's being sent out in the chat box, and it's also at the bottom of some of our slides. Just so you see how we're going to spend our time today, we're going to go 30 to 35 minutes with our featured speaker, Dr. Joseph Kvedar, VP of Connected Health at Partners Healthcare. And then we'll have our Q&A. So without a further delay, I'm going to turn it over to Dr. Kvedar. Doctor, thank you for joining us today.
Thank you, Anthony and Kate, and I'm delighted to be part of this. I'm thankful that I get to do the verbal part and not do the verbal and ask to be in the tweet chat, because we all know how it's multitasking is not what it's cracked up to be. So I'll look forward to seeing the learning from the tweet chat, but excited to do the webinar. Now, you can already see that I've sort of changed up the title a little bit. I think we're talking about the same thing, which is how digital health, digital therapeutics can rival what we now think of as our therapeutic tool set, which is drugs, in terms of managing chronic illness. And it's a pretty fascinating area. It's one of these things, having been in the digital health space for over 20 years now, that I see over and over again is people like to throw out new names for things. So no name confusion meant. This is indeed about beyond the pill. The term that we've gone fond of is digital therapeutics. It all is really the same thing. Now, I got interested in this area just about 2 years ago, actually, and at that time I was heard a fact that caught my ear and really caused me to stop what I was doing and really think, and that was that in 5 years we'll have 20 billion everyday objects that will be connected, and they'll go from being inanimate to being smart. And now in just the 2 years since I had that epiphany, things have started to really happen, whether it's the Nest thermostat or Amazon's Echo or other mobile apps that you use that are location aware and send you messages when you cross the threshold at J.Crew or CVS. Any number of these things are Internet of Things applications, and it seems like we're surrounded by them now, whereas about 2 years ago it was just starting to come into play. And so what we're going to talk about, again, for about a half hour is how that might play out in healthcare. And I'm going to start and take a little bit of time because I think it's important to paint a vivid picture of what we're talking about. I'm going to tell you a story. I was, as I said, inspired to do this work and come up with this book, which has been out for just about a year now and is really doing quite well. It was done with my co-authors. You can see here Carol Coleman and Gina Cella, and what I'm going to talk about today is really a distillation of the high points of this book about the Internet of Healthy Things. And I want to start with a notion that I'm this is, again, we're 5 years hence now, so I've just decided to take part in a health benefit offering from my employer, Partners Healthcare, and that health benefit offering involves me getting a personal virtual coach, not a human being, a software-driven coach. And the deal goes like this. In exchange for me giving up lots and lots of personal data, and you'll see what I mean by that very shortly, I get access to Sam. And I do sometimes do this presentation with voiceovers from Sam because we're in a webinar format. I get to play me and Sam, so you'll, again, meet him momentarily. But because of the richness of the data that I am personally throwing into the environment, Sam can be very specific in his guidance for me in terms of my health. The second thing I want to mention about Sam, so the first thing is I decided to give my data up. That's something that people find controversial. That I didn't mention that in this scenario, I got a very, very nice cut in my contribution to my health premium cost. So I get a reward that's both financial and health. And the other thing you should know about Sam before we do the story is that Sam is like a drill sergeant. Now, that's because I conceived of him knowing what would motivate me and how to get me into a zone where I'm actually doing something differently. If that's offensive to you as a listener, fear not. We can design Sam any way that will be appealing to you, but it has to motivate you. It has to motivate you. All right, so that's enough intro. We're going, again, 5 years hence into the future. I'm waking up on a morning, and the first thing out of bed, I get this message from Sam, which says your blood pressure and cholesterol are fine, your sleep deficit is getting up there, you're gaining a little bit of weight, and your activity is falling short. Now, here's the kicker. You're going to have to do better if you want to reach your goal of fitting into your tux for your daughter's wedding. That's an important part of this story. It's not about whether I'm going to have a heart attack in 10 years. It's about a near-term goal. All right, so that's my beginning of my day. And Sam is really trying to help me. So he's trying to help me so that I can look more like the fellow on the right-hand side of this slide, not the left-hand side. And if I don't do anything, maybe I'll go in the direction that's depicted here on the left. And my daughter, by the way, who doesn't know she's getting married in 5 years, that's a little joke we have between us, would much rather that the James Bond-like figure on the right show up at her wedding than the gentleman on the left. So how are we going to achieve that? Well, Sam, the other thing you should know about Sam is that he has access to data such as the ones illustrated here. I want to emphasize these are all screenshots from my mobile device that were taken recently, i.e. all of these data feeds are here today. So this story is not about the data feeds per se, it's about how we manage them and use them in terms of promoting better health. But you can see here there's activity, there's a number of other things, blood pressure coming in, some geolocation data and the like. In fact, I go have my breakfast, go to work, and then right around lunchtime, because I know Sam's watching, I'll have a light lunch and go out for a walk, and then I get a message while I'm walking from Sam. He said, I think you're walking towards the bakery to get one of those big chocolate chip cookies. Now, if you have that snack now, it's going to set you back. Why not save the calories and have a glass of wine with dinner? And again, that's the kind of very specific, in-the-moment, context-aware advice that we're expecting to get from these artificial intelligent agents as we go forward. And so, indeed, I did follow that advice in this story and walked around the building one more time, went back to my office for more meetings, less activity, as we all experience. And as I'm wrapping up for the day, another message comes through from Sam. It says, hey, what about swimming? You're only a block from Boston Sports Club. And I noticed they're having a half-price thing. There's a coupon right here in the message. I see 5 other people in your online social network that might do this. And there's 3 times when you could swim with at least one of them. How about taking it up? What do you think? Now, this combines several feeds. Once again, none of this is science fiction. You know of people, and particularly in the retail industry, who have done things like this, where you get this melding of data feeds that have social, geolocation, and so forth mixed in. So what's interesting about this one is I haven't done any kind of swimming for exercise seriously since I was in medical school, so I have to really scratch my head over that suggestion. It makes so much sense on the one hand. On the other hand, I'm kind of frightened by the idea. And then I get a text from my daughter who says, I think swimming would be great for you, and thanks for skipping the cookie. So you can see in this story that I'm telling how this all winds up. You've got social influences from other family members. You've got artificial intelligence guiding me in a way that's very specific. And I'll say it again, nothing about the data feeds is novel. It's how we manage them, and that's what I want to spend the time with you this afternoon or morning. So the idea is that this future is near term. It's automated, contextual, motivational, empowering. As I mentioned, I have some very strong incentives, both social in terms of the wedding, financial in terms of my health plan. All makes sense. And so what's missing is really the rest of the talk and how do we get there. So I break it up into these three areas. Now, the title of the slide is Automating Healthcare, and indeed that's the goal here, which SAM is not a person. SAM is an artificial intelligence agent. And right now, again, 2 years since we started conceiving of this book and a year and a half since its publication, artificial intelligence is now all the rage, and you've all heard about it. I hear about it, it seems, every single day, and the worry about people losing their jobs, et cetera, which maybe we'll tackle some of that in the Q&A because I have some very interesting thoughts about that. But what this boils down to, if we can string these three things in the equation together, we can achieve, and I will show you examples of this, improved health outcomes without involving pills, without involving directly chemical therapeutics. That's pretty interesting. And the pharmaceutical industry is, of course, very slow to change. If you had their margins, so would you be. But they're starting to get this sense that they could have parallel businesses in the world of software and mobile apps. And so this, again, is starting to happen. It's pretty interesting. Now, what I'm going to do is I'm going to go through the first two parts of this equation relatively quickly, but I want to set them up and have you all understand how powerful they are in the overall thing. None of this works if the three components aren't there. Any one of the three components is weak. It falls apart. You get no SAM. You get the kind of lame messaging you've all experienced from an app that doesn't know anything about you or one of those types of artificial intelligence experiences. But what we're going to talk about most is engagement, and that's because, frankly, if we're going to get beyond the pill, I will tell you it's all about the engagement part. There's, in this particular version of this talk, undue emphasis on engagement, and that's very, very important. So without further ado, let's talk about the first part, which is the things in the Internet of Things. And there's two components to that. There's all the personal data that they generate that's unique to you, digital fingerprints. Some people use the phrase digital breadcrumbs. I've heard data exhaust as a phrase. It's all about these things that are very unique to do. Unique to you. There's a professor at Stanford called I'm blanking on his name, but he has just picked a new term. Like I said, people love new terms, called the physiome. If you know about the genome and the proteome and the microbiome, he calls this set of data about you the physiome, which is interesting. And I would think of it in that way. All of the device data, all of the geolocation data, throw in maybe mobile purchasing data, how many texts you send, not the content. And all of this stuff about you that's coming out of your device and the wearables and the Internet of Things is forming a unique profile of you. Once again, in retail, that's not news. People have been exploiting that for some time, and you're getting all kinds of really unique messages, both in your mobile world and in your browsing world, that are related to that profile. We can do the same thing in health. So the things come in, they create the data that feeds the analytics. And there are some innovations that we could do more of in the things area. I'm not going to spend time on that today. Again, if someone has questions about that, we can perhaps address it in the Q&A. Now, the next part is the machine learning, analytics, AI. When I started giving this talk, we called it machine learning or analytics, right? And all of a sudden, those terms are very 20th century and everything's about artificial intelligence. On the one hand, they are different. On the other hand, they're all talking about the same thing at a headline level. Now, this picture is from the Wall Street Journal, and I'll go through it fairly quickly. It was brought into the journal a couple of years back as a state-of-the-art example of how a pharmaceutical company was using analytics to recruit for a clinical trial on obesity. And if you read through a couple of them, I don't want to read through all of them. People with large cable TV packages are less likely to be active. People with pet owners are more likely to be active. So you kind of get the drift. These are what I would call, I guess someone thought they were insights. To me, they're common sense. And the reason I put them here and talk about them in this context is because if we're going to deliver something that's an experience like I had with Sam, we're going to have to do a lot better at the AI part and the analytics part. Even people are raving about Amazon's Echo, and even that still has a very long ways to go in terms of delivering what we really think of as really context-aware messaging, right? So the analytics is enormous opportunity. I know there's a whole generation of data scientists that are participating in this. Maybe they're working for companies like Facebook and Google, and maybe we need to think about ways to draw them into healthcare. But it's there, and this part will happen because there's so much interest, whether it's IBM, Watson, you know the players, and it's going to happen. So like I said, we have all the data elements, the digital footprint, the physiome. Then we bring it into this environment where we can analyze it and create that unique profile that's unique to you, that's different than me. And oh, by the way, this profile also knows how to motivate you. Like I said, Sam was built in a certain way for me that might be offensive to some other people who weren't quite as compliant. I'm a very compliant person. But after all of that, we have to understand how to motivate people. And so what I'm going to spend the rest of my time with you on is engagement, because I would argue strongly that if I don't engage you, if I know everything about you, but I can't engage you, I can't change your behavior and I can't change your health, and I can't go beyond the pill. So this is why I chose, when I was putting this talk together, to really emphasize engagement. And what I'm going to tell you now for the rest of the time are stories from either industry, I think most of them are from our own work here at Partners Connected Health, where we've shown that different kinds of interventions that are digital-based can have an impact that is as good as or better than a chemical therapeutic, to give you some sense of how we might go beyond the pill. These are all research programs. Most of them are. I think I have a couple of examples that are, I'm just double-checking, that are beyond. Yes, I have a couple of examples that are other industries, but essentially this is most of our work. So you can see before you now, I've already flipped to this strategies and tactics slide. This is just a framework to think about engagement, and I've chosen to use it. This comes from a chapter in the book that I alluded to earlier, and I will go through now. I have examples of, I think, all but one of these. So the first one is make it about life. Here's an example of what I mean by that. This is from a study we did on using trackers and how engaged people were with trackers. Trackers meaning things like a Fitbit. And it turns out that when we looked at this, and remember, when we're studying this, we know exactly how engaged you are, because if you don't wear the tracker, we can tell that. So engagement here is very finely measured. But you can see that high engagement, much higher engagement, grew in terms of a group of people who had friends and family involved. And that's why we say make it about life. I see this in my own practice. When I ask patients, I see they've got something on their wrist. What's going on? What do you think about it? They're coming to see me as a dermatologist, not as a person involved in connected health. And almost all of them say, oh, I'm in a competition with my ex, my loved one, my spouse, my child, someone at work. So this whole idea that engagement around trackers and using the tracker data as a source of truth, very powerful, and it's really about your day-to-day life. Now, make it personal. I'm going to spend a little time on this one because this is both an exciting example and it ties together a lot of what we've been talking about, and it does move us beyond the pill. So the context here is type 2 diabetes, and we asked a question when we started this. We started this as a text messaging program, and we've morphed it into an app subsequently. But we wanted to know, could we design a system that would inspire people with type 2 diabetes to be more active? And here's the catch. We couldn't involve a human being. We couldn't have people, coaches calling them. We wanted it all to be software-based. So we took these 4 data streams. You see them around the periphery of the diagram. Readiness to change. That's a way we can, within asking a few questions a few times during the intervention, calibrate how interested you as an individual are in being more active. The second is, of course, the data stream from a wearable. That's a given, right? We're going to, it's like the free space on your bingo card. We're going to assume that if we're doing activity, we're going to track activity, and we did. The third is some location data, not fancy data like Sam had. This is very basic, like where your address is and where your doctor's office is. And the fourth is weather. And if we took those 4 data streams into the analytic engine as pictured, and then sent each individual in the intervention a daily contextual message on those, inspiring them to be more active, that was the goal. 1 message a day contextualized by those 4 data points. And it turns out that if we do that, we end up, after 6 months, no human intervention, with an intervention that, compared to a control group, has a significantly lowering of hemoglobin A1C and, more importantly, better, of course, activity, but the patients that were in the intervention did as well as if they were on a drug, metformin specifically. So here's an example of a digital therapeutic, a well-designed, thoughtful mobile intervention for type 2 diabetes. All right, remember we're going through the strategies and tactics. Make it social. Social gets involved in just about everything we do. It's such a powerful human intervention. So this one is about Facebook. It's about kids with asthma, but you can think about so many different implications of social and digital health. Kids with asthma they should fill out this thing. You see the title of this on the bottom, Connect to My ACT. ACT stands for Asthma Control Test. It's a standardized questionnaire that kids fill out. And the value is it tells us how subsequently they will be likely to have a bad event, end up in the emergency room, et cetera. It's a very, very helpful planning tool. They don't really fill it out. And their attention to this thing, if in a usual healthcare scenario, is about 18%. So we were brainstorming with the pediatrics people at MGH, and we said, well, why not put it where they are? Let's create something in Facebook. And sure enough, when we created a Facebook group for these teenagers with asthma, and I promise you that's about all we did. This was not a complicated intervention. Their adherence to the tool went up to 79%, as you can see here. Their final score went up 4 points, which is an improvement that is equal to or better than a new inhaler. Once again, showing that a digital intervention can rival a chemical therapeutic for efficacy. Couple more, and I'm going to accelerate a little bit here because I want to leave enough time for our Q&A. This is Subliminal messaging. The story on this one, this is an app we created for cancer chemotherapy, oral cancer chemotherapy adherence. And the reason it comes into here isn't how it works well, but it's because when we went out to cancer patients, as we always do before we design anything, we connect patients and bring them in and get their feedback. They were offended that we thought that they would need any kind of adherence app for anything, because it's cancer, for God's sake. We take it very seriously. So we designed this to do everything but remind them to be adherent. It's, as you can see, it's all this other stuff that just helps them through their journey with oral chemotherapy. And we happen to track adherence, and the people that use the app were much more adherent. But we had to get there not by reminding them to be adherent, but by helping them with all these other things. That's what I mean by subliminal messaging. Another cancer one is EPAL. This one is for cancer pain management, and it has all the features you see here. It's largely about keeping people in touch with how they use, and these are largely people in the palliative care service, how they use opiates, et cetera, for cancer pain management. And people are afraid of this. This is a tool that they can take home in their pocket that helps them with that fear and helps them with all those questions. And at the end of the journey, I want to show you the data on this one. Once again, this is not a chemical therapeutic, but the graph shows that at the end of the intervention, actually at the midpoint and at the end of the intervention, they had significantly lower pain levels just by using this mobile app. So 3 examples of digital therapeutics for you. I'm going to close out with the Sentinel effect in terms of the engagement tools, and I have a couple of other examples I want to share from industry that I think are interesting in this regard, especially if you come from a health system, and given that this is health system CIO, I probably guess that most of you do. But anyway, back to the Sentinel effect. So the Sentinel effect is really this idea that if you, as an individual, know someone you care about is watching you, you behave differently. And these are 2 examples. One of them, a cardboard cutout placed by the bike rack at one of our subway stations, which led to less bike thefts. Cardboard cutout, that's right. And then the other is these dynamic speed displays, which I'm sure you've all seen going down the road, and typically you slow down. So that's because in some of your mind you think maybe someone's watching when they're not. So the Sentinel effect is very powerful. Our example of that is a home blood pressure monitoring tool that we use for chronic illness, and it's illustrated here. Again, because I'm wanting to make sure I get through everything, I'm going to cut this one relatively short and say that when we went back to our patients and asked them why they felt this tool was effective, they said we continued to collect our data and enter it because we didn't want to let the doctor down. And if, by the way, the flip side is also true, that if the doctor or the nurse didn't refer to the data when the patients were interacting with them, they quit. They said, well, we quit because it's a lot of hassle and nobody seemed to care. So the Sentinel effect, really important to bake that into your design, especially if you're coming at it from a provider perspective. All right, as I said, I want to do 2 more from industry. They're just general. This one I think is very exciting. This is from United Health Care. It's called the Motion Program. It uses a unique wearable that has activity tracking, but also can track gait and some other interesting things. It allows them to come up with these 3 goals called FIT. So they've enrolled a couple of 100,000 enrollees to date through their plan sponsors. United is a giant behemoth, so they can do something fairly quickly like this. You get the wearable for free. That's interesting. If you achieve any of these goals, so frequency means you get up once an hour and walk for 5 minutes. Intensity is your, I believe it's a 30-minute brisk walk, and tenacity is your 10,000 steps. For each one of those, you get $1. If you do all 3, you get an extra $1. That's why you see on the bottom $4 into the health savings account. That's the experiment they're doing, is that can they reward people financially with real health savings dollars into their account based on the data that they're giving up. Doesn't that sound a little bit like what I foresaw when I said SAM was something that I chose to do because partners rewarded me with a lower premium cost? So you've got something in the market that approximates that. Will be interesting to see how they do. On the other hand, Walgreens already has data. So Walgreens, many of you may know, but if you don't, Walgreens, if you have a wearable and you use their app, they have a strategy that lets you link your wearables data in, and if you achieve certain goals, you can get rewards points in their store to use to buy stuff based on your health goals achieved through wearing the wearable. That's interesting. What's even more interesting, though, is the data that you see displayed here, because what they're doing is asking you as a consumer to give up data, and then they're mapping it back to adherence. And so, as you can see, what they reported in this brief that they published was adherence to hypertensives, adherence to antidiabetics, adherence to statins, all improved significantly. These numbers are all statistically significant. No specific doctor involved, no specific sign you up for any specific intervention. This was all people who just signed up and agreed to choose to share their wearables data with Walgreens in exchange for these coupons. Now, there's bias here, of course. Of course there's bias here because it's people who agreed to sign up, who already own a wearable, et cetera, et cetera. But it's still interesting, and it's interesting because they've achieved these population-level successes without direct involvement of a healthcare provider. So I think it's worth pondering. So that's a quick run-through on what I call the Internet of Healthy Things, digital therapeutics, call it beyond the pill, if you like. Remember these three building blocks, the things themselves that create the unique digital fingerprint, the analytic or a machine learning piece, and then what we spent most time on, because it's, in my opinion, most critical, is engagement. And with that, I'm going to leave my contact information up on the screen and turn it back to Anthony. Thanks very much.
Well, thank you very much, Dr. Kvedar. It was a great presentation, and we appreciate it. Now we have time for some Q&A. So go ahead and send your questions in the Q&A box. Leave the default set to all panelists, and we will take a look at those questions. All right. First question for you, Doctor. I understand for machine learning we need quality data, and there is no standardization in data collection in healthcare. What is the practical problem with standardized data collection?
It's a great question, and I do have a version of this talk where I spend more time on that particular problem. It's an enormous problem. If you have a solution, the marketplace is wanting one. I can describe the problem in graphic detail by saying, as I showed on a slide, I own a Withings weight scale, and I do pay a lot of attention to my activity, which is calories out. If I'm meticulous and put my information into an app like MyFitnessPal, I can have calories in, and I can even display them all on the same screen these days. That's all done through APIs and integrations. They don't tell a story. They don't relate to one another because of this lack of standardization. So it's an enormous problem. Your listener is quite right. We have to solve it before we can get to the vision that I described.
Very good. You mentioned social media outlets, especially Facebook, as being powerful tools in engaging with young patients, but are you still seeing hesitancy on clinicians' part to use these tools? What can leaders do to encourage this?
Yeah, so that's a great question. I would say a couple things. One is social is a powerful influence, period. It doesn't just have to be with children. It certainly didn't have to be with millennials, and Facebook was really just an example. We build social experiences into every intervention that we design and deploy here because it's so powerful. So again, social could be connecting with me, my wife, knowing my health activity. It could be for someone else, it could be their children, as was in my story with Sam. It could be something to do with with another loved one or your mom and dad. Bringing the doctor in is tricky, that as you all know, because you're health system people, doctors have so much to do now. We're demanding so much of them. This is really one more thing. I would suggest that the best way to handle the doctor part is to have them be comfortable with the use of these social tools. As I said, if you're collecting information about patients, at least get their buy-in that they will discuss those data with the patients when they see them in the office. That's an incredibly big program killer if the docs don't even acknowledge that this is happening. In our system, we do only this if the doctor actually, it's like a prescription. They have to get the patient involved, but still it's a challenge, and it's a challenge that we have to work through because you'd rather just sort of pick your population of people with high blood pressure and put them on a program. But if you just do that and you don't get the doctors looped in, they'll kill it by not paying attention. So I think getting their assent that you're doing the program and pleading with them to at least put in that same 5-minute bucket about other health maintenance things or other descriptions at the beginning of a visit will help a lot.
Very good. Back to the previous issue about data. There's a question about the future of FHIR and interoperability of EHR and possibly AI. I don't know if you've got any thoughts on that, you know, the FHIR interoperability standard.
Yeah, no, one of the maybe successes so far for me has been that I don't have any deep knowledge whatsoever of technology. So I know FHIR, I know what the words mean, and I know a little bit about some other standards in the marketplace. For sure, we need an easy way to integrate these data into electronic records. Right now, FHIR seems to certainly be the leader for that, so to that degree, I'm very supportive. It turns out, though, that there are always other things to solve. For instance, there's not uniform agreement in the EMR or I would say health information services community about whether you can just plop values into a record without human oversight. Some people say, well, look, this is like any other test you order. But other people will say if you're collecting patient-generated data, you as a provider ought to bless and sign off on the readings that get put into the record. So that certainly goes beyond standardization, but that's just one example.
Very good. Well, for our listeners out there, we are. I am currently working to put together another webinar on FHIR, so we should be able to get you some good content out there soon on that topic and what people are doing with FHIR and finding success. Next question. Walgreens offered incentives to get people to give up their data. What can physicians and hospitals do? Are incentives enough, or is it more complicated than that?
They are, because of anti-kickback statutes and things like that, but I have to say that frankly, the problem is less about getting docs to want to give incentives as opposed to the flip side, which is dealing with the more common physician objection, which is I don't care about that data, I don't really want it, it doesn't help me. These are all phrases that you hear, and it's somewhat disheartening because it speaks to a level of, I don't know whether you call it arrogance, but to be able to say that some data about your patient isn't relevant, I think misses the mark. You may not have the capacity to fit it into your workflow. It may be that you're not sure of the actual fidelity of data coming from something like a Fitbit or a home blood pressure monitor. But to say you don't need it, I think, is probably not the right thing. So what we find ourselves doing is trying to help clinicians embrace the concept that patients are alive 24/7, not just the 10 minutes that they're in front of them, and that these data are going to be helpful with standards like FHIR, with other kinds of normalization tools, and ways that we can then use software intermediaries, somewhat what I was describing in the analytics section, to actually present meaningful data analytics as opposed to just strings and strings of data. That's where we're headed, and I think when we can get there, doctors will be more comfortable with this. But right now, it's really not as much of a problem with incentivizing. It's more a problem incentivizing the docs to pay attention.
Yeah, you mentioned the idea of volume, and I think that's something we hear from physicians about physicians and their objections to being inundated with Fitbit-type data, just tons and tons of data about different measures that people are taking about their blood pressure or this or that or whatever else. The physicians are concerned that I don't need, I can't digest, and I certainly don't want to be responsible for having reviewed this massive data, because what if I miss something and then I'm culpable down the road? So any more you want to talk about on that issue?
Well, again, I think other industries have managed this quite well. If you use the airline industry, which I know we often do when we're talking about safety and whatnot, but they have all kinds of ways of guiding an airplane and bringing up data, dashboards for pilots that crunch lots and lots of complex data and make it into simple, actionable stats. I know we can do that with blood pressure. I know we can do that with activity. So it's really incumbent upon us to get our act together. Of course, no one expected any doctor to look at hundreds and hundreds of random readings. That was never the intent. And I will address the liability thing because I think it's important to do so. That's something that as a society we have to grapple with. Indeed, I was told by our attorneys that if you order home blood pressure monitoring for your patient, it is like any other test you order and you're responsible. So, of course, today what we do is we put frontline providers on those dashboards, and they look at the data and so forth. And we tell the patients when they sign up, we have them sign off on a consent form that says this is not a substitute for 911. If your pressure is 200, please seek help. So we mitigate as much as possible, but it's that liability thing is something we're going to have to really address. Right.
Do you have any specific messages for CIOs and other hospital IT folks about this trend and what they need to be doing in their health system to sort of, skate to the puck of where things are going?
Yeah, it's a great question. So I used to report into our CIO for many years. I was part of IT. I have really robust relationships with our IT folks here at Partners, and I think the CIO challenge here is really, it's not unlike in a way the BYOD challenge is. You've got a lot of external stuff wanting to come into your system, and you want a system that you can make sure is locked down and secure and private and standardized. And so it's really, how did you deal with BYOD? That's how you're probably going to learn some lessons on how you deal with patient-generated data. It's definitely coming, as I said, and one of the most exciting things about it, and one of the reasons I was excited about this, is the idea that we can create applications that are as good or better than a pill, and that is going to take hold, and that's really going to change the way we deliver care.
All right, one more question before I let you go. We talked about Facebook. There's other social media platforms out there, and who knows what the next one will be. Is figuring out where people are, where they're going, and where they've left an important element of this, to know that they're not where they were anymore, so we need to move as well?
It is, I think. It's part of that make it about life strategy that I talked about is part of the reason the Facebook study was successful is because we put the request to fill out a survey in the midst of an environment where they already were, and we made it easy for them. We didn't expect the side effect, which is that their asthma would get better. That was pretty exciting, but we just wanted them to comply with filling out the tool. Today we'd probably do that on Instagram and have some game around images or Snapchat, I don't know. So in a way, it really is keeping track of where people are and following. by the way, I would just say that in all those examples I just mentioned, I'm fully aware that they're not secure. This stuff was done as research. The Facebook group was walled off, so we did protect health information in that way, but I just want to make sure I'm not advocating that you go out and build something on Snapchat or Instagram. I'm just saying that it's that kind of thinking that will help solve this problem.
Excellent, very good. Well, when you we're about finished today. When you close out your window, you'll be taken to a post-event survey. If you would fill that out, we'd appreciate it. Regarding continuing education, if you have the CHIME CHCIO certification, attending our webinars gets you 1 CEU, so let CHIME know you were here, and if you've asked us to do so, we certainly will. You'll receive an email when this archive recording has been posted to our YouTube channel. If you would like us to produce a webinar for you, you can contact Nancy Wilcox. You can go to our website to see our upcoming schedule. So with that, I want to thank our featured speaker, Dr. Joseph Kvedar, and I want to thank our audience for attending today. Everybody have a wonderful day. Thank you.